This is Dr. Corey Maas on Looking Your Best. I'm here with my fellow today, Dr. Dan Butts, and we're going to talk a little bit about wound care. I think there's not enough emphasis on when we take care of wounds all the time, and we certainly know a lot about it and enjoy it, but when a patient comes and has surgery, unless they've had a little bit of education and knowledge about how to take care of their wounds at home, then we can really get behind the eight ball. And in fact, 90% of the wound care done after facelift, eyelid surgery, ear surgery, browplasty, any of the surgeries we do, frankly, the nose surgery, 90% of the wound care is done by the patient at home. So having a good perspective on what to do and the things that you can do to make sure you're improving your outcome by doing the best wound care is really what we're talking about today. And I'd break that down into really a couple simple systems and a couple simple principles. The first one is that wounds heal best in a moist, clean environment. So when we talk about moist now, a lot of people think that a hard scab, for example, is the way scabs or wounds should heal, and that's good. Scabs are never good for wound healing because mechanically, as the skin heals, the bridge, even if we've connected them together with sutures, there's a small bridge effect or a little gap, microscopic in the case of sutures, where the skin cells have to migrate across that. That's a physical activity that takes mechanical energy from the body to occur. When there's a scab in between those edges, it literally has to push that hard plug out of the way to get those skin edges to meet. So as I tell all our patients, the ideal wound, scab, if you will, is a soft, gooey scab. And a lot of people will ask about this. There's not much surface area usually that we see with this, except in skin resurfacing. But soft and gooey, or a nice clean edge with ointment on it, more importantly when there's sutures involved, is ideally what we see. So when we're taking care of wounds at home, I think it's also important to understand that probably the best thing we can use is keep things clean. Soap and water may be the best antimicrobial there is. So in our typical skincare regimen, we're asking people to 2 times a day, wherever there's incisions or wounds that we've made, sutures or no sutures, either one, that they're washing with soap and water and that they're applying an ointment. Now sometimes when I say an ointment, I typically recommend an antibiotic ointment. There's many out there. We use a triple antibiotic ointment like this. I'm not brand specific. We'll often use bacitracin, and really brands don't matter very much. They all meet a good standard for activity, and they really serve, if you think of a nice layer of ointment over a wound, as a physical barrier or a Band-Aid. So really using these when we have incisions around and behind the ears and facelift, right in the columella or just on the inside of the nose on rhinoplasty. On the upper lids with blepharoplasty, often I'll choose something that doesn't have an antimicrobial like an Aquaphor product or a special product that I have formulated that has some growth factors and other things in it. But basically these don't have things that are eye irritants. The problem with the ones that have antibiotics in them is they can kind of melt and run in the eye. So that's the one exception. But in general, moisture with some type of an ointment is really important in terms of promoting wound healing. And then when people ask me, well, washing with soap and water, when can you do that? Well, every doctor is going to have some different idea about that. We typically will start the second day after surgery with soap and water washes, a good antibacterial soap like Dial. If you want to get fancy and use something like Hibiclens or one of the other sort of more sophisticated antimicrobials, that's fine. But really any antimicrobial and Dial soap is probably the most commonly known one, are fine. In fact, I tell patients really to get liquid Dial soap, put it in the shower with them, and when they have incisions behind their ears like they would in a facelift, to just use it like shampoo. We're not worried so much about the hairdo at that point, and we really want things clean. We don't want to soak, saturate it, or have it on there for a long time. In fact, we don't want to shower. We don't even want to bathe. We want to be in the shower, lather up, let the soap clean everything off, rinse it carefully, pat it dry. And that's really dependent upon the type of surgery you do. For example, with rhinoplasty surgery or nose surgery, wouldn't want to get the cast wet. And there's some alternatives we can use in those cases to the uses of soap. And the most important one probably is hydrogen peroxide. And I think hydrogen peroxide, there's a lot of misunderstanding about it. There's 2%. You can get this at any pharmacy. We give it to our patients anyway, and it's applied with Q-tips. But hydrogen peroxide on open wounds, like a sore that you might get if you skinned your knee, is not good. It actually impedes wound healing. But when they're closed and there are sutures there, it's very effective in debriding. It sort of bubbles when you apply it, and that's sort of taking up the little dry blood or scabs and helping them come to the surface, and then they can be gently patted away and one of the ointments then applied that we talked about. So this is true in general, and what we'll do is take a clean little cup. We don't dip this back in onto our face and then into the bottle back onto our face. That's contamination. But we'll have a little intermediate sort of medicine cup type of thing. In our clinic, we keep these around, but at home you can just use something clean. And I think the most important part of this is making sure that you're using clean hands. That probably is the second most important message that I'd give you, anyone doing wound care, is that if your hands aren't washed frequently, we inadvertently touch things all day. Many people have pets and other types of things that they're going to touch, which are potentially contaminated. And so washing their hands frequently will keep us from touching something not good and then touching our face. Dogs may be clean, cats may be clean. Cat saliva has a lot of bacteria. Dog saliva, obviously, I think we all know what dogs lick and eat. So we just really want to wash our hands with pets in particular in general, but just in the environment that we're in, we're touching things that may or may not be contaminated. So when we're cleaning wounds with peroxide, like we might in rhinoplasty, just a little drop on the Q-tip, and they'll insert it into the vestibule, just to where the cotton ends, really, and just gently let that bubble and clean any crusting or debris around the inside of the nose. Noses are a little unique. We use lots of saline washes instead of soap and water to clean the nose and flush that out. But in principle, we're able to clean the dissolvable sutures inside the nose with a little peroxide, and then apply a little bit of antibiotic ointment, again, just to the end of the Q-tip on the inside of the nose. If we're doing it, and Q-tips are nice to have. They don't have to be sterile like this, as long as they're clean out of the package and people have clean hands. We're not at home, you're not in a sterile environment anyway. But the other way to do it is make sure and wash your hands. Generous applications of the ointment along any suture line or any open wound, as we describe, is very, very important. So to summarize this, wound care is a very important part of what you, the patient, can do to make sure that your healing is fast, effective, and germ-free. We don't want any infections in our patients. And that's the main thing to avoid. Hand washing is critical, and then doing washing and keeping the wound moist. Wounds heal best in a moist, clean environment. So there's lots of ways of keeping moisture on there. Follow the recommendation of your doctor. We have a series of antibiotic ointments that we give our patients as part of their post-operative care package. And any of the soaps that are antimicrobial are completely acceptable. In fact, any soap at all, as you could even use Dove soap as something, a gentle, mild soap, if you so desire. So did I cover everything, Dan?
So, yeah, absolutely.
Okay. So if you have any questions on wound care or healing, please don't hesitate to reach out to us, drmaas.com, or you can visit my website at maasclinic.com. And as always, it's my pleasure to help you stay looking your best.